नमस्ते। आज हम इस वीडियो में ऐसे टॉपिक पर बात करेंगे जो जानना बहुत 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 ज़रूरी है। Hi everyone, I am Dr. Ritika Dhingra, CEO Lux Skin Clinic practicing in New Delhi. So today we are talking about a really very important topic that can save your time and money. As people are making a lot of common mistakes and have so much of misconceptions when it comes to the management of their skin. So, in today's topic, we'll talk about 10 things that I am going to mention one by one. If you are doing them, you are not getting the most out of your skincare or most out of your skincare routine. So, if you are doing that, stop right away and let's discuss the first top common mistake, that is
using expensive moisturizer.
is using moisturizer. No, expensive moisturizers. So आप डिपार्टमेंट स्टोर जाते हैं, ब्यूटी स्टोर जाते हैं और आपको एक बहुत फैंसी सी बॉटल विद एन एक्सपेंसिव अमाउंट आपको दिखती है, तो आपको ऐसा लगता है कि वो मॉइस्चराइज़र बहुत अच्छा काम करेगा और हम उसके इंग्रेडिएंट्स पढ़ते तक नहीं हैं एग्जैक्टली क्या है उसके अंदर. सो इफ़ you are planning to have a moisturizer, so don't go with these expensive ones until and unless you can buy it. At the end of the day, they are just moisturizers with no active ingredient, so don't waste your money. Some moisturizers will do their work if you are using it properly. You do not need any high-end luxury moisturizer if the goal is just to moisturize your skin. So do not fall for these expensive moisturizers as they have fancy bottles and expensive packaging. At the end of the day, just look what's inside. Honestly, do not fall for these fancy bottles and expensive packaging. At the end of the day, you should look what's inside, basically the ingredients. If they are not containing any active ingredients or any anti-aging ingredients, so you are just overspending on something that is doing nothing for your skin, just to moisturize, and that's it. And sometimes I visit some stores, any department stores or beauty stores, makeup stores. So I just saw an expensive 3,000, 4,000 moisturizer. They are doing nothing just to hydrate your skin, and what are they doing is simply a normal 200 or 300 moisturizers can also do. So don't fall for these. The top second mistake is
Not using retinols in your anti-aging routine.
not using retinol or avoiding retinol. If we talk about anti-aging, the topmost ingredient is retinol. If you're not doing that, if you are skipping the retinols, you are not in an anti-aging routine. If you are not using the retinols just because you are afraid that you can't go out in the sun, this is a very common misconception that if you use retinol you can't go out in the sun. No, a big no. Yes, you have to use your sunscreen in the morning and you have to reapply it every other 2-3 hours. So don't skip your retinols if you are following an anti-aging routine. The fact of the matter is, as there is probably not a more powerful and most important anti-aging ingredient other than retinol. So if you are planning to go for an anti-aging routine, don't skip your retinols. If you are trying to reverse aging changes, that is loss of collagen, pigmentation all around, and you want more cellular production and cellular growth and in life of the skin, so you should consider retinols along with sunscreen. Don't think कि retinols यूज़ कर रहे हैं तो हम सन में नहीं जा सकते. No, आप सन में जा सकते हैं, बट मेक श्योर सनस्क्रीन आप अप्लाई करें. बिना सनस्क्रीन के बाहर निकलना, इट्स नॉट गुड फॉर योर स्किन. So if you are using retinols in addition to your sunscreen, and you will be fine. So don't let that sun factor hampering your decisions of using retinols. If you have started your retinols, your skin might feel a little bit of redness, irritation, dryness, skin becomes scaly. So don't get afraid. This is very much normal response from your skin. स्किन थोड़ी सी ड्राइनेस आ सकती है, रेडनेस हो सकती है, ये सिर्फ 2 या 3 हफ्ते ही लास्ट करेगा और after 2 to 3 weeks your skin will become normally fine, and you can use your retinols as much as possible in your skincare routine. So don't afraid to use your retinols in your anti-aging routine. So I think there is no specific reason for not using your retinols, just for having a fear for not going out in the sun. Don't skip it. Number 3.
The most common third mistake is only relying on SPF, which is blended in your makeup.
Is using sunscreen that is blended into your makeups, foundations, concealers, powders. They have written that foundation or BB cream with SPF this, with SPF that, they are having a UV protection. No, makeup is makeup, sunscreen is sunscreen. Sunscreen is non-negotiable. You can't apply your makeup without your sunscreen. So if you are going out and if you are lying inside your house, don't skip your sunscreens. There's probably no more important step than to protect your skin other than sun protection. I mean it. So if you are working and you have to apply your makeup on a regular basis, but please don't rely on that makeup SPF. Do apply your sunscreen first, then apply your makeup. If you are going for laser treatments, having a good skincare routine, hydrofacials, medicated facials, you are going through these on a regular basis at a monthly intervals. But if you are not using your sunscreen with these treatments, you are just damaging your skin. So important step that you should get it right, and you should know how to use that product and reuse it properly. Sunscreen is the only source of sun protection that you are using, and if it is blended with the makeup, there is no chance you are getting the proper sun protection with your sunscreen in your makeup. So apply your sunscreen first, and it should be applied in a way that it should be applied, and reuse it the way it should be reapplied it on your skin. I'll be very delighted if you use a mineral based sunscreen very religiously and dedicatedly. So you can apply sunscreen first, and you can apply after that your makeup, your BB cream, CC cream, foundations. Yes, you can apply that, but after applying your sunscreen first. Second, don't try to kill 2 birds with one stone. I think you will get it my point, that you shouldn't apply makeup with sunscreen and thinking about that you are getting the sun protection with this makeup along with your SPF. Number 4 is using lasers or any skin treatments as your only skincare. I can't tell you how many patients and people came and get their laser treatments or chemical peels or IPLs and fractional laser. They undergone that laser treatments, but they do not apply your routine religiously. Sunscreen skip कर देते हैं, active ingredients skip कर देते हैं, और after they came back after a month or so and they complained that we didn't get any results. They solely rely on these treatments. No, a big no. These treatments can only work effectively if you are using your routine properly. If you are not using your routine properly, these treatments are literally waste of time and money. So let's have an example. If you are using if you are undergoing a Q-switch laser for your brown spots, that will suppress your brown spots, that will clear your skin, but they can't suppress the new one. So if you want कि आपके new spots ना आए, you have to follow the proper skincare routine along with your chemical peels and along with the active ingredients, sunscreen especially. These laser tools, chemical peels, injectables are very good great tools for your skin, but it is only effective if you're using your if you're having a good regime, if you're following your proper skincare routine, proper sun protection, then only it can give results more appropriately.
Number 5 mistake is being inconsistent with your skincare routine.
So let's talk about the number 5. Number 5 is being inconsistent with your skincare. Skincare means you have to do it for forever. That means कहीं पेशेंट्स आते हैं, हफ्ता करा, 2 वीक्स करे स्किन केयर और उसके बाद दे ड्रॉप इट। और कहीं और अच्छे पेशेंट्स होते हैं, वो स्किन केयर फॉलो करते हैं 1 मंथ, 2 मंथ, 3 मंथ्स, देन दे ड्रॉप इट फॉर 2 मंथ्स, then again they start again for again 6 months, 7 months, then they drop it again. How a skin would react in these cases? No, it won't. As I'll explain you with one example. इफ़ यू आर डूइंग एक्सरसाइज, इफ़ यू आर गोइंग टू जिम, आपको अपने मसल्स बनाने हैं या वेट लूज़ करना है, यू शुड बी कंसिस्टेंट। ऐसे नहीं कि 1 महीना बहुत अच्छे से एक्सरसाइज कर ली, लूज़ कर लिया एंड यू आर डन। नो, आप जैसे ही एक्सरसाइज छोड़ दोगे, खाना वापस से वही नॉर्मल रूटीन पे आ जाएगा एंड अच्छे से सोओगे नहीं, तो यस, आप जितना आपने लूज़ करा है उतना आप वापस गेन भी कर लोगे। Same goes with your skincare also. How? I'll tell you. If you're using any active ingredient, either vitamin C, retinols, azelaic acid, arbutin, but if you're using it consistently, skin आपका collagen produce करने लग जाता है at a cellular level. But अगर वही चीज़ आपने कंसिस्टेंटली उसको 6-7 मंथ्स अच्छे से कर लिया, स्किन अच्छा रिजल्ट देना स्टार्ट कर देती है। बट अगेन, अगर आपने उसको ड्रॉ कर लिया, विड्रॉ कर लिया, उसको छोड़ दिया वहाँ पे 2 महीने के लिए, 3 महीने के लिए उसको छोड़ दिया, योर स्किन विल रिवर्स। अब जिस स्टेज से आपने स्टार्ट किया था उसी स्टेज पे आप वापस आ जाएंगे। If you have stopped your skincare routine, all of a sudden you will come back to at that stage when you have started. So don't practice super inefficient. Trust me when I say this. The most important part is that if you're using any skincare routine, if you're following a good skincare regime, follow it forever. Don't do this sometimes stopping, sometimes starting. You just stop suddenly, you just start suddenly. Don't do that. If you're following a good skincare regime, please stick to that, and I promise that it will pay off.
Number 6 mistake is over exfoliation, that is using too many actives in your skincare routine.
Number 6 is over exfoliation. What is over exfoliation? That means you are exfoliating too often, or you are using any harsh exfoliators. That means that you're using scrubs, loofahs, आजकल बहुत सारे फिजिकल स्क्रब्स आते हैं, आप लेके अपने फेस को मसलते हो, उनसे स्क्रब आउट करते हो, बॉडी पे लगाते हो। कॉफ़ी स्क्रब्स आते हैं जो आजकल बहुत ट्रेंडिंग है मार्केट में। नो, स्किप दैट। फर्स्ट ऑफ ऑल, येस, एक्सफोलिएशन क्या है, क्यों करनी चाहिए एक्सफोलिएशन? येस, इट इज़ इम्पॉर्टेंट एज द टॉप लेयर ऑफ द स्किन, दैट इज आर स्ट्रैटम कॉर्नियम, दैट नीड्स टू बी रिमूव्ड। येस, इट गिव्स बेसिकली, जैसे एज इंक्रीज होती है स्ट्रैटम कॉर्नियम बिल्डअप होता है, वो हमें एक डलनेस देता है हमारे फेस को। येस, इट नीड्स टू बी रिमूव्ड, बट हाउ? Basically हमें exfoliation, either you can consider chemical peels, either you can consider in-house peels, either you can consider microdermabrasion. My personal favorite is chemical peels, but you should undergo these treatments with a licensed professional, not do from here and there. हम बात करते हैं कि एक अनियन की जो बाहर की लेयर होती है वो बहुत डल होती है। जैसे ही हम उसकी लेयर पील ऑफ करते हैं, दैट वी गेट अ फ्रेश अनियन, अ ब्यूटिफुल पिंक स्किन। सो एज सिंपल, जैसे ही अनियन की बात कर रही हूँ, ऐसे ही हमारी स्किन केयर में होता है। जैसे ही आप अपनी स्किन की डेड लेयर रिमूव करते हो, येस, यू विल गेट अ ब्राइटन स्किन, जो कि हमारी एक्चुअल स्किन होती है। बट कैसे उसको रिमूव करना है, दैट इज़ द मोस्ट इम्पॉर्टेंट थिंग. आप उसको गलत तरीके से रिमूव करेंगे या ओवर एक्सफोलिएट करवाओगे, बहुत ज़्यादा आप रिमूव कर देते हो, तो दैट विल कॉज डैमेज टू योर स्किन. Why am I obsessing over this chemical exfoliation methods other than physical exfoliative methods? First of all, these harsh physical scrubs will, आप उनको अच्छे से ब्रश ऑफ कर रहे हो, स्क्रबिंग कर रहे हो, उससे क्या होता है बेसिकली. पहली चीज़, आपका स्किन बैरियर ख़राब होता है. व्हाट इज स्किन बैरियर? स्किन बैरियर इज़ बेसिकली अ हेल्दी layer of your skin that goes deeper into your skin, that provides hydration. जैसे ही आप अपने हार्श केमिकल्स या फिजिकल मेथड से अपनी स्किन को एक्सफोलिएट कराते हो, वो बैरियर ब्रीच आउट हो जाता है. आइदर यू कैन या स्टेरॉइड्स यूज़ होते हैं, स्किन बैरियर ब्रीच आउट हो जाता है. उससे आपको रेडनेस, इरिटेशन, फ्लेकिंग एंड इट इवन can cause skin abrasion, skin atrophy also. So I don't consider these methods as appropriate methods for an exfoliating. And yes, if you are doing this exfoliation overly, means you are going to have an over exfoliation with these scrubs, obviously how it can lead to a healthy skin. So just consider chemical exfoliation methods other than physical one. And don't over exfoliate your skin. Once in a month is sufficient.
Number 7 mistake is the most common one, that is using sunscreen but in an inconsistent manner.
So, number 7 is using sunscreen inconsistently. What does this inconsistently means? Some patients came to us and we told them कि you should apply sunscreen if you want an anti-aging routine, or if you want to consider that the sun should not break your collagen, so you should consider sunscreen. But patients sometimes say कि मैम बाहर तो क्लाउडी है, बाहर आज तो बारिश हुई है, आज सनस्क्रीन क्यों लगाएं, या हम तो घर के अंदर ही होते हैं तब सनस्क्रीन क्यों लगाएं. नो, whether you are outside, whether you are going outside, or whether you are in your home, you should apply sunscreen. Sunscreen is non-negotiable, and as you know, this is my personal favorite ingredient for anti-aging. And why am I telling you to apply your sunscreen? As you know, sun breaks down the collagen. Basically, sun is the most important factor of your aging. Or yes, hormones and genetics also play a role, but we can't make sun an exception. Yes, sun plays an important role in breaking down the collagen, and you will get an aged skin. Many people came to us and in their 60s or 70s, and they have a very beautiful skin, and not with wrinkles, with pigmentation, loss of volume. No, they don't have that. Yes, they have applied their sunscreen in their early ages, and they are very consistent enough. So if you want कि आपकी स्किन अच्छी रहे, एजिंग डिले हो, रिंकल्स फॉर्मेशन इतनी ना हो, फाइन लाइंस ना बने, सो sunscreen is non-negotiable. Please do apply your sunscreen, but consistently. No, you should not apply in an inconsistent manner. आज लगा ली, कल नहीं लगाई, आज बारिश हो रही है तो आज रहने देते हैं, आज धूप है तो आज लगा लेते हैं, हम तो आज घर के अंदर ही हैं तो आज रहने देते हैं. No. Some patients came and they say कि मैम आप सन एक्सपोजर होता है तो हमें विटामिन डी मिलता है. यस, आपको विटामिन डी मिलता है, बट फेस से ही क्यों काम कराना? अपनी लेग से करा लो, अपने आर्म से करा लो. लेट दे गेट टैन एंड हैव योर विटामिन सी. लेट योर बॉडी डू द कन्वर्जन. वाई ओनली फेस? फेस इज लाइक इट्स द मोस्ट इम्पॉर्टेंट थिंग दैट यू हैव टू लुक इट फॉर एवरीवेयर. कोई भी आपसे आके मिलेगा, आपके पहले फेस को देखेगा. वाई यू हैव टू डू दिस वर्क विद योर फेस को प्लीज़ आप प्रोटेक्ट करके रखें. इफ़ यू आर गोइंग ऑन अ वेकेशन, इफ़ यू आर गोइंग आउट, हैव सन केयर प्रॉपरली, हैव सन प्रोटेक्शन प्रॉपरली, और नॉट अलॉन्ग विद द सनस्क्रीन. ऑल्सो कवर इट विद योर सन ग्लासेस, विद योर हैट्स, विद मास्क. As much as possible, if you can protect it, do it.
The last mistake, that is number 8, is brushing your teeth after washing your face.
So, the last one, that is the eighth one, is brushing your teeth after washing your face. I think this is the most common mistake the most youngsters will do. उनको बहुत जल्दी होती है फटाफट नहाने की, तो क्या करते हैं, पहले नहा लिया, वॉश कर लिया, फेस वॉश कर लिया, बॉडी वॉश कर ली, देन दे डू द ब्रशिंग. बट वॉट हैपन्स इज, जब आप ब्रश करते हो, जब वो सलाइवा या टीथ की जो डर्ट है, बैक्टीरिया जो वहाँ एक्यूमुलेट हो रखा है, जो कोलगेट या पेप्सिडेंट आप टूथपेस्ट आप जो यूज़ करते हो वो एक्यूमुलेट हो जाता है. इट कैन लीड टू एक्ने, breakouts, or even perioral dermatitis. So just have the brushing of your teeth before washing your face. First brush your teeth, then wash your face. It means if after washing your face, it can lead to cleanliness of your debris, the toothpaste you have used, the saliva that can accumulate, the bacteria, the germs, सब कुछ आपके फेस वॉश करने से सब कुछ रिमूव हो जाएगा. So, in order to prevent perioral dermatitis and acne and perioral pigmentation or acne, make sure आपका जो सलाइवा या आप जो ब्रश कर रहे हो वो आप अपने फेस वॉश करने से पहले करें, उसके बाद नहीं. आई होप आपको मेरी ये वीडियो बहुत अच्छी लगी होगी, एंड आई ऑल्सो होप अगर ये आप मिस्टेक्स कर रहे हैं तो आप इन्हें इसी टाइम ही रोक देंगे, और ऐसी वीडियोस और ऐसी स्किन और हेयर से रिलेटेड जानकारी जानने के लिए आप हमारे चैनल को सब्सक्राइब कर सकते हैं, और जो ये मिस्टेक्स कर रहे हैं आप ये इस वीडियो को उन लोगों तक शेयर कर सकते हैं. थैंक यू.